Hi everybody, you may have heard of a concept known as oil pulling. What exactly is oil pulling? It's usually using coconut oil or sesame oil, and you would take a teaspoon of that in your mouth and swish it between your teeth for about 10 to 15 minutes and then spit all that stuff out. It's claimed to have a lot of benefits, and the benefits, besides cleaning your teeth of course and providing anticavity and improving the health of your gums, they also say it improves a lot of systemic conditions such as diabetes and blood pressure and various other claims. Now, if you look at the actual research available for oil pulling is not really very vast, and the amount of research available is also not great, meaning the problems they had with the research were a very, very small sample size, and they were just not doing the research for long enough to actually know. So there are a couple of papers which compared oil pulling to chlorhexidine, which is a sort of a gold standard for mouthwashes in dentistry in terms of prescription mouthwashes. And they found that oil pulling does better in some cases, and other papers found that chlorhexidine does better in terms of plaque reduction in the mouth. There's also a paper which shows that oil pulling does better than toothbrushing for bad breath. So these are the various claims being made in the literature. But like I said, the evidence is not strong. We need papers which really examine the problem for a longer time with a lot more participants. And a very interesting thing is there is no paper which compares oil pulling to that oral hygiene tool which dentists have been recommending for a long time. It's easy to do and doesn't take 12 to 15 minutes, which is flossing. I would really like to see a paper comparing oil pulling and flossing, because flossing is what helps get food out from between the teeth and really improves the health of the gums. So that should be a more direct comparison. But all of the studies either compare oil pulling to toothbrushing or they compare oil pulling to chlorhexidine mouthwashes. So that's new research which should be coming up, hopefully soon, when someone picks that up. There is another big concern of oil pulling, and this is a phenomenon known as lipoid pneumonia, where basically you have oil which enters your lungs. And you can imagine if someone is swishing oil between their teeth for 12 to 15 minutes, then you know that there is a good possibility that you can have them aspirate or accidentally breathe in that oil, and that is going to cause a lot of issue for their lungs. So these are things to watch out for. Most patients, when presented with this concept, are not very keen, because 12 to 15 minutes is a long time to ask of anyone. To get patients to brush their teeth after dinner is hard enough. To get patients to floss their teeth is almost impossible. And then to get them to oil pull for 12 to 15 minutes is really going to be incredibly challenging. So these are certain concerns which I still have with oil pulling. So to summarize, do I recommend oil pulling to each and every patient? No, I do not. The evidence is just not there. It's not strong enough to tell us that oil pulling is a better alternative to toothbrushing or flossing. And it's really something that needs a lot more research before it can be recommended as being an effective oral hygiene tool for our patients.